Hello, Dr. Lim. Nice to meet you.
Nice to meet you.
Can you please introduce yourself to our viewers?
I'm Im Jong-in, plastic surgery specialist from Soonplus Plastic Surgery.
All right. So, Dr. Lim, today we'll be talking about Smas facelifting. So, what is Smas facelift?
What is a facelift? Well, as we age, the skin and tissues in our faces lose elasticity and start to become saggy. By doing a process of altering and removing the excess loose skin, patients can recreate what they used to look like in their youth, especially if you don't remove the layer called the smas, which is located beneath the fat layer and the skin layer. It's hard to regain the kind of facial elasticity that a person has like they had before, so I'd say this procedure is very important.
So, doctor, you just talked about the Smas layer, right? So, can you explain a little bit more about Smas layer?
The smas layer is, first of all, an abbreviation of a very long term, meaning superficial muscular aponeurotic system. To simplify, there's a skin or epidermis layer, and right below the skin layer is a fat layer. That's the superficial or subcutaneous fat layer, and beneath that, there's a layer made of muscle. Between the fat and the muscle, there's a thin elastic layer, like collagen. That right there is what you call the smas layer. It's practically a layer that separates the subcutaneous fat layer and the muscles, and in that area, a fat layer is attached to it. So it doesn't stay by itself. It loses its elasticity and sinks down. When that happens, the fat layer also sinks down as well. So the bottom part, right here, will start bulging. So the solution to this kind of problem is that we lift the smas layer up. This also lifts the fat layer and the skin above that. This procedure is what we call a full facelift. The face is kept lifted as we age, as it is an important part of anatomical structure.
I see. So, doctor, this is a question that asked by a lot of our patients. The scar after the incision, does it last forever?
First of all, when discussing scars from an operation, any procedure that was done with incisions, scarring is almost an inevitability. So as a doctor, I try my best to make incisions that are invisible to the naked eye. So when I do a full facelift, I try my best to keep the scars as minimal and as hidden as possible and make sure any scarring doesn't turn bad. I would control the pressure and put extra care with the stitches.
Okay, so for this kind of lifting, can you do it only once?
This kind of procedure isn't a simple one-and-done thing. Even if you've had the operation once, because of the pressure of the remaining tissues, the smas layer that I mentioned earlier, along with other facial layers, will start to sag again. So this kind of sagging will start again around 10 years or so, and your face loses elasticity a bit more, similar to before your first procedure. And when that happens, you can have another facelift again. The face being saggy due to the loss of elasticity and the skin loosening, it's not always related to aging. Some people manage to keep the elasticity of their skin even as they age, while some younger people lose that kind of elasticity, resulting in saggy skin, especially when a person goes through a dramatic weight change, such as gaining a lot of weight and then doing a strict diet, therefore losing the weight they gained. There'll be a lot of tissue left. Another factor is if your health has gotten worse as of late. Chain smoking, nutritional imbalances maybe. As a person's overall health gets worse, there are cases out there where it seems as if they're aging rapidly. In that case, young people can also get a facelift. And even if a person's condition is considerably well compared to others, but they simply wish to look younger, they can have a facelift performed at an early age.
Okay, so usually after the facelift, what should people do to manage it?
Right after the surgery, it is of utmost importance to protect the skin and tissues of one's face from any source of strong irritations. At an early stage, we wrap the face with bandages or we use an elastic band that fixes the face so that the skin doesn't move. it is important to preserve it until when it's time to take out the stitches and to protect the skin from the sun. It is important to be careful as to not cause any irritation on the skin, as the presence of bumpy scars can be there. But pigmented scarring also exists as well. There are times in which a slight redness gets around the surgical scar and irritation occurs. During the healing process, if you see a lot of sunlight during that time, the exposure to the sun can cause pigmentation, changing your scars to a darker color. So it is important to prevent such things. Within the first month, at that time frame, there are cases that the internal structure of the face becomes firm or unstable. If you give too much stimulation, it might get harder, or pigment might get deposited. It's nothing too serious, but there really needs to be a period of protection. Whatever kind of surgery it is, a complete recovery is at the very least 6 months away with any operation. A body's cells find ways to start repairing wounds, and eventually there are only traces of it. It's called the maturation of scars. At that perspective, in every surgery, there's a set amount of time, usually at least 6 months, for scars to mature and heal. But that really isn't the case. Patients don't really need to worry too much after a month, and it only takes 10 days to take the stitches out. Give yourself 10 days, then the stitches are gone, and a normal daily life is possible. And after a whole month forward, you'll be healed enough to do anything in your daily life. So what I tell my patients is that they be careful for about 2 weeks, and I tell them not to do anything drastic for an entire month. What I'm trying to say here to the people is that recovery time doesn't take as long as one imagines. First of all, wrinkles around the neck can be caused by many reasons. The most common one is when a person's neck is folded back and forth. The repeated use in the areas where it's mostly stimulated would cause folds like such. The way human beings like us move our necks, it's movement that's been developed by habit, and most of them are continuous repetition over time. And under the skin, we have a layer of subcutaneous fat and a muscular layer, and the fat layer that's down the bottom continuously fades. As the wrinkles get deeper, it's because as the fat layer disappears, the wrinkles become deeper and deeper. This is what people say about wrinkles, about how hard it is for them to hide it, as it comes naturally as you age. The most common form of it would be at the sides of the neck, and also there are many more. For example, once again, as we age or our skin gets thinner, fine wrinkles would show up all around the neck. This is because the skin gets thinner and it loses its elasticity. In addition, when the sagging is serious, right under the chin, the excess skin sags into a specific form, giving off that double chin look. It is because the muscles in the neck, also known as the platysma, become saggy, meaning that the sagging extends not just to the skin, but also to the muscle layer as well. That would make these two lines. It could cause this kind of problem as well. So, it's hard to say that wrinkles around the neck is caused by one particular reason alone. So when one wants to do something for the wrinkles around their neck, self-diagnosis would work to a certain degree. But meeting a plastic surgeon is essential to understanding it correctly, which makes the plastic surgeon's diagnosis needed. As I said before, there are various reasons on what causes wrinkles around the neck, so it needs to be treated according to the cause. When there are deep horizontal wrinkles around the neck, just like the facelift procedure, we can lift the skin after removing the excess skin. Or there is another procedure such as transplanting fats or filler directly to the neck in order to spread out the wrinkles. Of course, when you have deep wrinkles, it's impossible to go back to the time when the wrinkles weren't formed yet, but we can improve the sagging skin situation by a little bit. So what we do to the sagging part of the skin, we do a procedure where we gradually fill it in. Whether it is fat grafting or fillers, we have ways to improve the saggy skin by filling it up. And for the wrinkles formed vertically, it's usually caused by the thinning of the skin and the loss of elasticity. And there are no other options but to make incisions on the skin. The skin needs to be pulled to the back, so around the neck, this skin needs to be pulled back and the parts are stretched below the neck. If the muscles are stretched, we can start with an incision under the tip of the chin by gathering the sag platysma to the center of the neck and by sewing them together in order to tighten the sagging muscles. These are the various ways in which we can treat the neck.
So, Dr. Lee, is it possible to do like neck lift and neck wrinkle flat grafting at the same time?
When doing neck lifting, it completely separates skin from the inner layer of muscle called the platysma. So, when it gets separated, it gets pulled behind the ear and around the hairline. So, we make an incision and pull the rest of the skin. Fat grafting can also be performed on this anterior side. If you make an incision on either side and pull them, it only makes sense that it won't have much strength left right here in the center. To compensate for that, the procedure of fat grafting is a good solution.
So usually the patient expects a lot of scars after the surgery, or usually there aren't any scars?
The first thing I try to do is to make sure that there isn't as much scarring as possible. The surgery is performed on a part behind the ear, right where it folds and through the hairlines. So my focus is directed on these areas that are hidden to the naked eye. A scar would form, whether it's a double eyelid surgery or any other surgery. Yes, if you do any surgery, scarring will occur. So the best course of action is to perform the operation on parts where the scars aren't visible. That's why when we do the surgery, we put a lot of care into it. We do our best when stitching our patients in order to minimize scarring. Whether it's a facelift or a neck lift, it's hard to expect how long these results will last. We usually say it is roughly 10 years, so it's safe to assume that amount of time. But since everyone has different types of cells and elasticity, it wouldn't be the exact number. If a person has good elasticity, then the results would last longer. But if a person lacks elasticity, then it'll take a shorter time and the skin starts to sag again. It really isn't the same for everyone, so it's hard to give an exact answer, as there's different variables for people. Whether it's a neck lift or a facelift that you're having, the surgery is expected to last about 10 years. Therefore, you'll go back to the way you were 10 years ago. That is, if one decides to go through with the surgery. After around 10 years, your face will look like how it looks like now. And that's one way to see things.
Thank you, Dr. Lim, today for your time.
Yeah, thank you.
That was all my questions. I hope to see you next time again.
Yes.
So, we talked about facelift, neck lift, and neck wrinkles. I hope you found this video helpful, and I'll see you next time. Thank you.